Thanks everybody for joining us today at Community Connections. I first wanted to just say we're so excited to have you and have Dr. T with us. But first, I wanted to just give us a quick video from Tony Gwynn Jr.
The American Lung Association has been saving lives by preventing lung disease and promoting lung health in our local communities for more than 100 years. And today, achieving health equity is at the core of everything we do. We believe everyone should have the same chance at healthy lungs and clean air, but we all know that too often those families with the most to lose get the least access to quality health care, the finest hospitals, and even clean air. This is one reason we've launched Community Connections, free, interactive conversation with San Diego healthcare professionals and medical experts on the health topics most affecting our communities. My fellow board member, Dr. Tim Morris of UCSD, likes to call them dinners with doctors. For more information about weekly topics and more, please visit lung.org/events. I hope to see you there.
Well, thank you, Tony, and welcome everyone. My name is Dr. Tim Morris. I'm a volunteer with the American Lung Association. I'm on what is called the Mission Committee for the Lung Association, and it is our group that has organized this Community Connection series. I'm heard my name, Morris, is hard to pronounce, so you can call me Dr. M if that makes it easier for you. This series that we're about to have is about to start right now. Is an ongoing weekly series. You can see that the schedule there. We've already done several ones in the series. One that was an introduction was about the effects of smoking and vaping on your lung health and how that can make the risk of COVID-19 worse. We've had some talks from Dr. Welsh about how to maintain your overall health during the pandemic. We heard about some of the science about vaccinations from Dr. Sydney Ramirez. And I understand that those talks are currently available on YouTube. If you missed them, please do check those out. They're really fascinating to listen to. The purpose of these talks is to be able to transmit some technical and unbiased information to the general public and to you about maintaining your health during the COVID pandemic. The Community Connections is supposed to be like having a doctor to your house for dinner. So that's the nickname of it, is have a doc for dinner. And the Community Connections is made possible thanks to a grant from the San Diego Foundation. While I have your attention, I would like to point you to the American Lung Association website, which has a number of tools that you can use to maintain your health during the pandemic. One of them is a COVID-19 vaccine toolkit that can tell you some pointers about how to get the vaccine, why you should get the vaccine, and maybe that can be used either for yourself or your friends and family so they can make a nice, well-informed decision on vaccination. There's also a link there to the Lung Help and Tobacco Quit line, which can provide some great opportunities for you to stop smoking now, since as we heard already in this series, that stopping smoking and stopping vaping can improve your health during the pandemic and lessen your risk of having problems. Our program is going to include an opening presentation, and then there'll be a panel discussion from several area experts who are currently listening in and will join us at the end of our talk. But right now, let me welcome Dr. Sayone Thihalolipava, if I pronounce the name correctly, or Dr. T as he's known to his friends. Dr. T is a health consultant for the San Diego County Public Health, and he is an expert on the management of the pandemic and the vaccinations and how to get them and what to do after them. He has been kind enough to volunteer to come talk with us about the pandemic and give us some pointers about how to get through it and how to get it vaccinated, how to keep safe. So Dr. T, thank you very much for your time, and we're anxious to hear what you have to say.
Of course. Thank you, Dr. Morrison. Thank you, everyone, for letting us into your personal space, really, in the after hours and tonight. And it seems like this series is wonderful. I actually want to personally go back and especially see that first one about the smoking and vaping. I used to be the medical director of tobacco control in New York City Health Department. So I'm personally very interested in that topic. So I appreciate all the work that you all continue to do. So I'm going to go a little bit quick, but please, I know we'll have time at the end, so let me know, of course, if any questions. You all can have a copy of these slides. I have no issue with that as well. This is the data in terms of the cases across the county of San Diego. Remember, we're the 5th largest or most populous county in the country, right? So it is important, and what we take measures that we take here do impact the country as a whole, and we often lead by example, which I'm very proud of. Here, so thanks to your efforts, right? So here's the cases, and you see the cases. First we didn't have as much testing, and then once we got a lot of more testing available, we were able to identify cases more and more quickly. We saw surges here and there. We saw the major surge that we had, of course, in the winter time, and then that go down drastically, right? And so even though we have activity that's not as high as where we were a few months ago, we still have a lot of cases activity, but those are not thankfully translating into as many hospitalizations as they did in the past, thanks to the vaccine mainly. Okay, but again, that does not mean we're out of the woods. This is where we are in terms of numbers of lab confirmed PCR cases. And unfortunately, we've lost over 3,600 San Diegans to this illness. Many of you may know people who've passed away from COVID. And even if you don't know anyone who's passed away from COVID, most of us know people who've suffered from COVID, right? Directly, whether they were hospitalized or whether they suffered at home. Many of us know people who suffered. And then if you don't know anyone who has not had COVID, you probably know people, or you yourself may have suffered from other effects of this epidemic, right? And pandemic, meaning maybe folks have lost their jobs, maybe there's other restrictions that have affected your income or other aspects of your life. Maybe you have to watch your kids while they're at home, up until this Monday, when many of our school districts were closed for in-person school teaching, right? So here's where we are now. We have a case rate and a testing positivity rate that has gotten lower, but again, it's still not as low as most of us are comfortable with. And we have what we have new that we didn't have earlier on are these variants of concern or of interest. And these are variants that the virus mutates. That's what viruses do. That's their job, right? Is to survive. So as long as they have opportunities to continue to replicate or continue to live, they are going to try to mutate in ways that is advantageous to them. So the bottom line in all of this is that one of the main reasons to get folks vaccinated, as many as possible, is to put dead ends, in front of the virus as much as possible, so the virus has less opportunity to mutate and infect others. So we are in the orange tier here. You can see here in this map of California, and you might not be able to see these numbers, but 83% of California's population is in the orange tier. California overall is one of the lowest, has one of the lowest case rates as a state. It's around 1.7% for the last 7 days. That's what they released earlier today. You may be hearing on the news that overall as a country, the case rates are increasing, and there are about 67,000 cases reported a day in the US. And the reason that's concerning is because while California is doing a great job vaccinating, some other states are not, and for various reasons. Or they're behind, or they have just a significant increase in cases, and we can't vaccinate fast enough, right? And they have sometimes different proportions of variants in those other locations, which may be more contagious, or to some degree, they may be make the vaccine a little less effective. But still, the vaccine is the best public health tool we have. And I did want to talk about, since you heard, earlier in the video that really we care about health equity, and I love that. I love that was said in the beginning. wanted to continue to remind us that cases are, just seeing the number of cases is one thing, but we all know that the cases, hospitalizations, and deaths are not equally distributed, right? This is just a weekly, a pull from one of our interactive maps that we have. It's a weekly updated map or dashboard, and it shows the cases across different jurisdictions. There's also a zip code option too. And you see that, some places are orange, but then there are still some purple and red areas just based on the case rates being higher in those areas. And then nationally, when the CDC looked at their first half of the death data from last year, they saw that on average, there was about a year of life lost from COVID-19. But then when they broke it up by race, ethnicity, you could see that a non-Hispanic Black male on average lost 3 years of life versus Hispanic males, which lost 2.4, or Black females who lost 2.3, as compared to non-Hispanic, white males and stuff. And so you see here that there is, and there continues to be, disparities in the way this rolls out. And I did not get to rural and urban. That's also an important disparity to think about. Thankfully here in our county, we have CAL FIRE, and we use and we've relied on to do a lot of our rural testing and vaccination events. So that's been a really strong partnership that's allowed us to increase access in backcountry. So as the tier system kind of in 2 months or so will be going away, and you may have heard the governor say around June 15th, as long as there continue to be, stable, low hospitalization rates, again, not zero, but and then there continues to be vaccinations, they are going to get away with the tier system, and then go back to looking at this in a new phase of working with and living and coexisting with coronavirus. But we still have to reopen responsibly, right? So there is still a light at the end of the tunnel. I am very excited. We all should have a lot of hope, but we all still have a role to play, and we will still continue to have a role to play. And so I encourage you all to be cautiously optimistic, not declare victory yet, and really try to help get the word about vaccines out. Right. This is an example. I know this is very technical, but CDC report that came out, I believe, last week or week before, April 5th, sorry, and talked about a reopening at a bar in Illinois, and there were 40-something cases, 46 cases, and then there was additional spread from those 46 people to other people and into other settings, and then that led to an outbreak and cases in places like long-term care facility, and even one hospitalization and one school closure, right? And then you may be heard in the news, there are these hotspots around the country, like Michigan as an example, that unfortunately, it's not just the number of cases is increasing, but there the hospitalizations and the deaths are increasing. And because a lot of the older individuals were vaccinated there, the people getting hospitalized are disproportionately now younger. So in the 40 to 65-year age range. I don't have a picture of that. So where are we with vaccinations, right? Let's get back to the main thing that I know we want to hear about and talk about, is that we have a goal. The state set a goal for trying to get 75% of Californians vaccinated fully by July 1st. And here in this county, the 75% equates to roughly a little bit over 2 million San Diegans. And this is when you look at those who are 75% of everyone who's 16 and above, because currently only 16 and above can get the vaccine. And 16 and 17-year-olds can only get Pfizer, whereas, if you're 18 and above, you can get the others. And about 37% of San Diegans 16 and above are fully vaccinated. And then another 23%-ish, are partially vaccinated, meaning that they got one dose of Pfizer or Moderna, the mRNA, messenger RNA vaccines that require 2 doses. If you got 1 dose of Johnson & Johnson or Janssen in the past, then you are fully vaccinated 2 weeks after that. Okay, so in terms of eligibility, starting tomorrow is a huge day for many reasons, but one of the big reasons is that starting tomorrow, everyone 16 and over in our county and across California will be eligible for vaccines, right? So if you live or work in San Diego, you will be eligible for a vaccine if you are 16 and over. Excuse me. And you can see here, if you want to see additional information, as a reminder, if you are 16 or 17, or if you have friends or family who are 16 and 17, let them know that they need to, and they can only get Pfizer. And because we're expanding it down to 16-year-olds, and we currently, today, for example, a 16-year-old can get the vaccine if they have an underlying condition that puts them at risk for more severe COVID. But tomorrow, any 16-year-old can get the vaccine. And so what we need to message, and you all as trusted messengers in your respective communities would definitely appreciate you all sharing this message, is that it is really important that 16 and 17 and young adults get vaccinated, right? And as someone who's been talking to many young adults pretty frequently, I realize that, younger adults have a different risk calculation. They may think that, hey, you know what? Yeah, I know people who got COVID, but they were fine. They weren't hospitalized. They didn't die. And that is true statistically, that many to most young adults do pretty well on average, better than their older counterparts. But that's not to say that it's zero, right? Even in our county, we've had pediatric deaths as down to 10 years old. And vaccinations are still the safest way to acquire immunity. And in addition, it's not that they cannot get hospitalized or die. And even if you don't get hospitalized, I personally have heard many stories, and I have two friends, I'd say, who are pretty close, who've gotten COVID, not been hospitalized, but suffered tremendously at home and have had long-term effects of COVID-19, right? So there are still other reasons, in addition to the fact that they may be the people who get it first, because the case rates are highest in younger adults, and then they may spread it to more vulnerable people, meaning more older people, people with underlying conditions, different settings where they may work, et cetera. And then drilling back to the earlier point that I made earlier, is that the more people we get vaccinated, the more barriers, the bigger the shield we have against these variants from developing, right? From spreading, and then new variants from developing. We know about the variants that are in existence today, but we don't know what the future variants will be, and they may be even worse. They may blunt the vaccine response even further, right? So we don't want to allow the virus opportunities to continue spreading if we can avoid it. So, and then going back to health equity, we produce now a weekly update to this map that you can find online. And this is our health equity zip codes that we've identified from various reasons as more vulnerable zip codes, right? The state identified 12 of them in yellow, and then we had identified the additional, 27, if I could do my math correctly. So you can go here, and then you can see what the proportion of vaccinations in these zip codes are, right? We want to make sure we are overcompensating, vaccinating more than we are in other places, because overall, as a trend, these zip codes are also places that were harder hit with COVID-19 than other zip codes in our county. And you can follow some of that data here. And this is a new table that we also now produce weekly, and talks to how many people in these areas are vaccinated over time. And you can see that the population, for example, in these zip codes, amongst Hispanics, 35% of those individuals have been vaccinated with at least partially, right? And then you can go down and you can see here, for example, Black or African American is 22.5, white is 35%. So it's really important that we get all of these numbers as high as possible. Then in other updates, I talked about the eligibility. I'll show you in a second. We just produced hot off the press these videos on how to use things like My Turn, or go to our county webpage to enroll and schedule an appointment for vaccines. We do have some no appointment sites. We had 2 yesterday, and then Friday I know we have one at Southwestern College in Otay Lakes. We have a lot of different resources about vaccines, things like addressing myths and concerns about vaccines, to the development process, and really FAQs, things like that, and videos that you can take and share. We have them in multiple languages as well, all on this one page. So you can go there, and many of us have children or nieces, nephews, or others in our community, and we want to, we're all wondering about when can kids start to get vaccinated. So the first company that has so far submitted data to the FDA, Food and Drug Administration, for potentially allowing or authorizing for emergency use these vaccines down to 12 years old is Pfizer. They just did that last week, and now that should probably be decided upon and expanded. The estimate is around mid-May to start. And then I'll talk about Johnson & Johnson in a second, and the other good news, especially to compensate for the pause in the Johnson & Johnson, is that Pfizer said that they can deliver more additional 10% of doses by the end of May. And then there continues to be vaccines that's given directly from the federal government to places that are trusted local clinical settings like community clinics, got cut off, and pharmacies. And this is really important because especially when we talk about communities that may have distrust or mistrust in the medical system, or and don't want to go, for example, to a government-run vaccination site, there have to be other options. And some of these options and some of the places where people trust most is their local doctor, their local community clinic, their local pharmacy. So it's important that they get vaccines as well. And then just wanted to spend a little bit just talking about the Johnson & Johnson. I know this is breaking news. Many of you are interested in this and may have already know this, so I apologize if this is repeat, but excuse me. Yesterday morning, the CDC and FDA issued a joint statement asking for everyone in the US to pause administering the Johnson & Johnson vaccine, or the Janssen vaccine. And you may hear those two names, Johnson & Johnson, Janssen. The Janssen is just the pharmaceutical arm of this mega company, Johnson & Johnson, that produces a lot of things, right? And so they came to this decision because there were 6 cases in about or almost 7 million doses administered of these events and these rare but serious blood clots amongst all females so far, 18 to 48 years old. And they all occurred within 13 days. So it's 6 to 13 days after vaccination, with the average or median being around 8 days, as reported today by the CDC's advisory committee. And so they all got this condition called a blood clot called cerebral venous sinus thrombosis, CVST. And not only did they get that, which is a rare event in general, let alone of vaccines, right? But they also got that in the setting or in the context of having low blood platelets, which is kind of a paradox. It's unusual because platelets are the ones that contribute to forming clots, so you usually don't have low levels of platelets. So this is very unique. It is similar to what you may have heard internationally with AstraZeneca. And so because of that, they did the right thing and they said, hey, let's hit the pause button because we need to look at these cases, better understand them, better understand what's contributing to them, what are the risk factors, and if we have to change our guidance at all or even stop using the vaccine. So they did that. And they had an emergency meeting today. They had a meeting yesterday, their CDC's Advisory Committee on Immunization Practices, or ACIP, right here. And they had an emergency meeting today earlier, which I did watch. And then we thankfully have the Western States Scientific Advisory Group, which I understand is meeting today or tonight, and met yesterday as well. And we're lucky to have 2 docs locally, Dr. Sawyer and Dr. Rodney Hood, on that group as well. So in my opinion, right, this is extremely unfortunate, of course, these events, especially since 1 out of the 6 did pass away. But what is reassuring in all of this, right, is that this should hopefully build confidence in the process. These are the most monitored vaccines in the history of vaccines, and these are proactively monitored in addition to the usual kind of ways that the medical establishment monitors vaccine effects and reports them to the CDC and FDA. There's also proactive monitoring through something called vSafe, and that's an application. If you did get the vaccine, you would have hopefully been told about vSafe, you hopefully enrolled in it, and then, for example, after I got the vaccine, I would get texts daily, and then after that weekly for a little while, just checking in to see how I was doing. And so this is the reason why they have these mechanisms in place, so that we can figure out and find these signals that may be of concern and then address them as quickly as possible. And please recall that earlier in the year, when we started locally rolling out the vaccines in our mass vaccination sites, we partnered with UCSD and contracted with them, and they had a site at Petco Park, and we saw a cluster of reactions occurring with the Moderna and with one specific lot. So we paused that lot, we worked with the state paused the lot, the whole rest of the country continued using that lot, meaning that batch of vaccines, even though California stopped. We worked with the manufacturers, the CDC, the FDA, and the state to investigate those cases. And then we allowed the use of that lot to continue, and really haven't had anything abnormal happen since. That may or may not be the case here. And so this is a little bit different of a scenario because we have this many cases. We know that this is a different mechanism of action. Something similar is going on with AstraZeneca to some degree. And so what the CDC, when they met today, the advisory committee, they did talk about this at length. Their slides are public. I'm happy to share those. But they concluded that this is being reported at higher than expected rates. They need to better understand this because they've only really been looking at the data for a couple of days, and this advisory committee, and because over half of the Johnson & Johnson doses that have been administered in the US have happened in the last month, they wanted a little bit more time. So they kind of voted to extend that pause for a few more weeks. They didn't say when they're going to end, and then re-look at that data, and they suspect that maybe even a additional case or two might also be reported after that. So we'll see what happens. Some other countries for AstraZeneca, different vaccine, but similar mechanism, they are using kind of different age cutoffs instead, and that's how they're adapting on their end. We'll see what happens here. This is not an issue, at least the CVST, the cerebral venous sinus thrombosis with the low platelets, is not a known issue for the messenger RNA vaccines. Okay. And we still have those available, and thankfully, there's no supply issues, but of course, there's never enough supply for the demand. So how do you get your vaccine, right? I know, sorry, that you talked about a lot of vaccines a lot already last week, and so I probably repeated a lot of that info, but really I'm here to talk about, okay, so you're interested in a vaccine. What do you do? What's your next step? And there's a couple different ways you can get a vaccine, right? And so here are the kind of the options laid out in one slide. And so I mentioned already that you can go to your trusted healthcare provider. They may or may not have the vaccines. Not every healthcare provider has the vaccines. And if you are, if they do, then that's great. That's the easiest solution. It's always best to do things in your medical home, right? These are people who know you, know your medical history. And then if that's not possible, of course, there's the county, there's other clinics, community clinics, there's pharmacies that you can go to, or your local pharmacy. And if they don't have any, then we have our own sites, the county sites that we run, we staff, et cetera. And then we have our partnerships with organizations like a lot of the major healthcare centers to do mass vaccination clinics or high vaccination clinics, right? So we can go to our website for a lot of that information. And then if you are a military dependent, you may be able to get it through the military, right? They do have a lot of vaccine, and I know that they're already offering it down to 16 and to families of people who are active duty members. Okay, so even though I'm going to talk to this a little bit, you can definitely, please feel free to watch these videos that were just produced. That's what I talked about a little earlier on how to use the MyTurn application, or the website. It's not an application, sorry, a website. And you can go to MyTurn, and then, or you can go to the county website and how to navigate those and make an appointment. Okay, so this is what you do when you go to our website, which is coronavirus-sd.com/vaccine, or you can just go to the main one, coronavirus-sd.com, and then you can click on here to vaccines. You'll come to this page, and then you could see, and here's our note that we're closely monitoring the Johnson & Johnson, and we're pausing right now. Then you can click on find a vaccination site, and it'll take you to this page, right? And you'll see here that you can find a vaccine site by location, or you can look at the schedule, and you can see what's conveniently available for you. And then you can click on, after clicking on there, you can click on the actual site, and then it'll take you to MyTurn to make an appointment. And then this is just additional information in terms of what to bring to your vaccination appointment. To be eligible, you have to either live or work in San Diego County, and you have to show proof of that somehow, right? Now that it's open tomorrow, starting tomorrow for 16 and over, it's not, you don't really have to prove your job anymore, because you'll be eligible just by being over 16 or 16 and older. And then you can bring something to show that you live in San Diego County, and if not, you need something to show that you work here. Okay, and then there's a lot of questions about second dose appointments. So the good news is that for the majority, of people, if you're getting your first dose, usually you work with that place where you got your first dose to get your second appointment. And it is important to get that second dose, even though the first dose, there's increasing data showing that the first dose is very effective. In the 2 messenger RNA vaccines, the second dose is even more effective, right? We see, for example, when we looked even locally, UCSD and UCLA looked at their healthcare providers, they published a report or a commentary in the New England Journal of Medicine, the best scientific journal, and arguably, and they showed that even though they did have a few vaccinated people who got infected after the first dose, they had even less after the second dose, and then even less after 14 days after the second dose, which is why we say to be fully vaccinated, you really need to wait that 14 days after your last dose. And so but it is still possible, even though it's unlikely, it is still possible. And so here's kind of directions if you're interested in getting your second dose, right? So depending on who you got it through, you probably have to work with them. The good news is on My Turn, for example, that we use, when you schedule your first appointment, you also schedule your second dose appointment. If for whatever reason something changes and we have to cancel a vaccine clinic, for example, because of lack of supply or something, we will proactively reach out to you. And then the last slide I have is just a couple of FYIs. One thing is that, many of you are here, you're listening, you're getting the facts throughout these dinner conversations. And so we really rely on you all to be trusted messengers. People listen to their friends, their families, and other people that they know are going through similar situations as much as, and they, of course, listen to people like medical providers, doctors and nurses as well, but it's helpful to have that message and the facts come out. And so if people are not sure, if you're hearing misinformation or what you think may be misinformation, just trust and verify, right? Everyone has a right to their own opinion, but have them hopefully make sure that what they're saying is factual and not spreading things that are going to be disadvantageous, right? If we know that certain communities are affected more, in my opinion, those communities should be vaccinated at higher rates, right? Because you don't want those communities, for example, Black and brown communities, to suffer more, right? When there's a vaccine that's available to prevent a lot of that suffering going forward, right? All good news. And then here's a webinar coming up on real world insights to promote vaccine acceptance. Here is a web page that you can sign up to be in the COVID Community Corps. And so this is a federal thing that they have. It's great. I get emails from them. They have different resources, et cetera. You can post to your social media, et cetera. And then, of course, you could sign up for our county texts and everything. And then you can also request presentations like this, but if you have groups or, where you at work or maybe a church group or whatever, if you want us to come present to you, we have a website, a Live Well San Diego website, where you can request community conversations, where we can come to you and to your organization or your group and talk to you all about things like vaccines. And that's all I have. Back to you, Dr. Morse.
Thank you very much, Dr. T. That was wonderful. And it was a lot of information in a short amount of time, and you pulled it off beautifully. So Dr. T, I'm going to ask now the members of the Lung Association Mission Committee, who are a bunch of local experts, to join us in a panel discussion. And I believe we have Dr. Philippe Montgrain, who is an expert in adult pulmonary medicine and with a particular emphasis on lung cancer and on critical care. There is Dr. Laura Crotty-Alexander, who is another adult lung specialist and a physician scientist, who is one of our previous speakers, who is an expert on the bad effects of smoking and vaping on the lung and its connection with COVID. We have Dr. Mike Welch, who is a pediatric allergy and asthma specialist, who spoke to us earlier about how to maintain your lung health during the COVID pandemic. So welcome to the panel members, and I believe Philippe and Laura, you are on mute, and you need not be. Sir, please, we'd love to have a lively discussion about these things. So I'm going to start off first, and some of these are questions that were just put in the chat box while you're talking. And the first one I'm going to start with is there was some concern about, are there any reasons why somebody would get the first vaccination of any of them, Moderna, Pfizer, whatever, and then not get the second one, besides for an allergic reaction? So we've covered allergic reactions in the past, and I think that we're all pretty confident that, you know, there are some unusual types of allergic reactions, usually are to the carrier stuff, the stuff that it was dissolved in. But as far as medical conditions, is there any reason to have gotten the first one and not the second one? And then also, maybe I'm going to do a follow-up question. Is there any reason, I ask this every single time, is there any reason why you can think of anyone should not get the first one, besides, like I said, this allergic reaction? So Dr. Shi, why don't you take the first answer, and then we'll spread around the panel.
Sure. These are excellent questions. Thank you. And in terms of getting the first dose, is there any reason medically why someone should not get a first dose? The only answer, because they likely have never had that vaccine if they've not got the first dose, it's if they have a known allergy, a severe allergic reaction to one of the components of that first dose or anything that's in that vaccine. And so if you have a severe allergic reaction, for example, to something called PEG, which is sometimes in colonoscopy preps or other things like that, then, you know, talk to your provider, talk to your allergist, and maybe the messenger RNA vaccines are not for you. But then maybe you should go with something like a Johnson & Johnson, assuming that the pause is unpaused, you know, at some point. And then there are also similar things that may be in the Johnson & Johnson stream or ingredients. But these are generally very low, minimal ingredients. They don't preserve any live virus. They don't have any preservatives. Sorry. So these are, you know, generally extremely safe and effective vaccines. And again, that's why we have these monitoring systems set up for these very rare events that do happen outside of the clinical trial, that we want to monitor, make sure we are ahead of, and change our guidance as needed. In terms of the second dose, really there's only if you had a severe allergic reaction after the first dose, or the CDC says if you had an allergic reaction to any degree in the first 4 hours, an immediate allergic reaction. And the way that you know if something's allergic or not is sometimes difficult, and maybe some of the other panelists might want to help out with this, but I know that there are several types of tests your providers could order to help support, you know, whether or not what the reaction, if you do have a reaction that's abnormal, whether that's allergic in nature or not. So please, you know, make sure your provider knows, and what can happen if you're deemed to have a contraindication to that vaccine and you're not able to get the second dose. First know that the first dose is very effective by itself. And then second, the CDC does say you could switch after 28 days to another type of vaccine. In this case, we only have Johnson & Johnson.
Great. Any other comments about that? So I know that I sound like I ask this question of everybody every single time, but are there any comments about, besides allergic reactions, are there other types of people, cancer patients, chemotherapy patients, patients on steroids, patients with immune deficiencies or hyperimmune systems or something like that? Can you think of anyone that you should say, no, you really shouldn't get that vaccination? Dr. Montgrain, you seem to be doing some body language there.
You saw me shaking my head. I get asked this a lot, Tim, as much by my patients as by my neighbors. And the answer is no. The only reason you shouldn't get the vaccine is if you've already had an allergic reaction to this vaccine. And like Dr. T said nicely, the PEG, I think polyethylene glycol, I think is what PEG stands for, is a component that some people may have a known allergy to, but for most people, your first vaccine is going to be, you know, your first exposure to these compounds. And I do want to reiterate that these allergic reactions are very rare. They're, you know, 2.5 per million, something like that. So it's very unlikely. There is no other reason that you should not get this vaccine, which means you should get this vaccine. And Dr. T was mentioning these allergic reactions. We call it anaphylaxis. It's kind of like what you might get to peanuts or a bee sting. And the clue to that might be hives, which are these kind of red, itchy target lesions, and swelling of your tongue and your throat, which is obviously the seriousness of this allergic reaction.
Great. Other comments from the other panelists? Dr. Karate-Alexander?
I'm just super quiet over here, but no, that all sounds really good. I did have one question in terms of, I've had people ask me, you know, if they're not a California resident, can they get the vaccine? If they're not a US citizen, can they get the vaccine? And I wasn't exactly sure of those answers.
So generally at our county sites or our contracted sites with our partners, which, to answer another question, are open to the public, in general, our guidance is just that you have to either live or work in San Diego County. So we don't ask for proof of status or anything like that. Does that help?
So they don't need a driver's license, or do they have to have any evidence at all that they live or work in California, or do they just have to say, yes, they do?
We typically ask for some form of ID. It does not have to be a driver's license. It could be really anything. It could be a work payment. It could be some mail or something like that. It does not have to be necessarily a driver's license, but that's what we have that on our webpage, and that was in my slides, which you all will get a copy of.
So even Raiders fans, if they somehow can prove some connection to San Diego. Okay.
Dr. T, it's proof of California residence or proof of residence in the county? Which is it?
Oh, sorry. It's San Diego County.
Okay.
There, and I'll pull up the page. Go ahead. Sorry.
While you're doing that, I do have a couple other questions from the audience. One of them had to do with some concerns about being able to get the primary data on adverse reactions to the vaccines. So this question was about the Moderna vaccine, but I suppose it would be applicable to everything else. Is there some, I know that all of us who have been vaccinated are asked the question about how did you do, are there any symptoms, et cetera, but is there some way, is there some posting of this data that an ordinary citizen like us can get on and see what the current level of adverse reactions to the vaccination is?
You want me to start? I can say that about every month or so, the CDC's Advisory Committee on Immunization Practices does get together. They do have public open meetings with their slides presented, and I'm happy to share. They didn't go into all of the other, today's emergency meeting was just focused on that Johnson & Johnson issue, you know, those, or at least those effects, or possible effects, I should say, but last time they met, which was it was February 28th to March 1st or 2nd, I believe, and they posted the data to date from VSafe, the data that they're getting in, as well as the data that was reported to them. So they talked about that. They talked about things like pregnant women, and you know how many pregnant women had been been reported, at least through VSafe, to have gotten a vaccine, and had they been seeing anything unusual for pregnant women who've gotten COVID vaccine versus, you know, the normal kind of or usual rate of things that happen to pregnant women, for example, like miscarriages. And the answer is no, there's no difference so far. And there are trials, of course, ongoing. So I'm happy to share that if that's helpful.
Please. Oh, by the way, we somehow accidentally strayed into a topic that I know something about, because part of what I do is I'm a as a lung doctor, I look at people that have blood clots in their lungs, and part of that syndrome is to have that bizarre heparin-induced thrombocytopenia, the strange thing that the Johnson & Johnson people may have uncovered. And the interesting thing is the probabilities. So the probability of having some sort of heparin-induced thrombocytopenia, if you actually get the drug heparin, is about 1%. And somewhere between 1 and 10% of those people actually have some problem with it, some clinical problem with it. So that would put it at about 1 in 1,000 or 1 in 10,000 of people who got that drug, for therapeutic reasons, and we would develop a problem. And in this instance, we're talking about 1 in 1,000,000. So it's a vanishingly small number, and I don't want to minimize that for the people who suffered from it, but it's a very, very small number of people that got this vaccine are suffering from that syndrome.
I agree. And do you mind, Dr. Morris, if I share my screen again and just answer Dr. Alexander's question? Okay. So this is, you could see here, I'm on our webpage, but when you go to vaccines and then sites and appointments, if you scroll down, it'll say here that individuals must be able to show that they live or work in San Diego County, to Dr. Welch's question, and meet current eligibility requirements, which tomorrow will be 16 and over. And then, so they have to bring a photo ID, some photo ID, and at least one of the documents. This is just for our sites. I cannot speak to, for example, if you go to their provider, their provider usually knows them, for example. If they go to CVS or something like that, or another pharmacy, they may or may not have these criteria.
Great. I have a kind of the opposite question from the one before about who should not get the vaccination, but it has to do with the reaction now that I guess as of tomorrow, almost every adult is going to be eligible within the county. And what if there are people who have a particular need for doing it? Somebody who's in one of those high-risk groups before, didn't happen to get vaccinated. Do they have an option for getting, somehow in the front of the line, or somehow getting a priority, or is it just going to be sort of the entire population in random order?
Probably closer to the latter, because excuse me, there's definitely going to be supply versus demand issues and constraints, and there continue to be constraints in supply, which of course was made worse by the pause of Johnson & Johnson. So in the beginning, there may be supply limitations, but I suspect that pretty quickly we'll probably be able to be accessible. The good thing is that, because there are a lot of different sites now with different pharmacies and clinics getting the vaccine and providers, we're not the only game in town, so to speak. And so there are a lot of sites. We also have things like Project Save, which is all throughout the county. We are working with contracted community organizations, often CBOs, community-based organizations, who have more, frankly, community trust than we do as a government. And they are working with individuals, and we give them appointment slots that they can fill up with whoever they recruit. And these are often people who are more vulnerable, or in communities that are more vulnerable and have higher rates of COVID.
Is that an actual problem or just a perceived problem? What I mean by that is, are there people who have wanted to get vaccinated, were eligible so far to get vaccinated, and were just told no? And we don't have enough for you? Or was it just a matter of saying you can't get it Tuesday, you got to come Wednesday?
Yeah, in the beginning, every time we open up the eligibility, there's always that problem initially, where there's more demand than supply. And then over time, it does lessen. So since April 1st, everyone 50 and over has been eligible, whether or not they have chronic conditions. And since March 15th, anyone 16 and above with any underlying conditions were eligible. So in the beginning, but because it's been a couple weeks, I think many of those people have had an opportunity to get vaccinated.
Great. We had a question from the group about the age restrictions, about, was there some reason why there are some vaccines that are open to younger ages than other? Is that just a kind of a product of how the studies were done and who was bold enough to enter, younger people, or was there some biology behind that?
I know I'm doing all the talking, so anyone else is welcome to answer. But yes, it's your first answer. Your first thought is the trial designs. Pfizer allowed individuals down to 16 to participate in their trials, whereas the others did not. Now they kind of seem to all be next trying to get folks down to 12, and then after that below 12. And so there is good news on that front so far with the trials that we're seeing, that it seems to be safe and effective under 12. I mean, under 18 or down to 12. Sorry.
And Dr. T already mentioned nicely that the Pfizer has requested FDA approval for the 12 to 16 age gap that was missing. And I don't know where Moderna is. Maybe you can update us, Dr. T, if you know, are they also currently studying it in 12 and up and going to ask for FDA approval soon?
Yes, I don't know the status of that trial. There is a table I've seen last week that has the status of all the pediatric trials, and so I'd have to check that, but they are definitely doing it. Then Moderna also has sites in San Diego County for folks down to 6 months of age as well. And so there are trials now for folks well under 12 years old as well. So we'll see when and how that plays out.
Dr. Welsh, in your pediatric population, are people going to be rushing the gates like they're trying to get to a concert, or is it going to be a hard sell for the younger kids?
No, I think the parents are as concerned about their kids as they are concerned about their grandparents or their parents, the kids' grandparents. I sense there's a growing want and need, for getting the vaccine in these kids. I think they'll have extra assurance that they can go back to school. There's still some school return reluctance because of this disease. And so I think the vaccine in this population is going to be very useful.
Are there populations that for the pulmonary and ICU doctors here, are there populations that you've seen that seem to express some reluctance, or in which the people with these disorders really don't want to get vaccinated or worried about it?
I worked one of the vaccine centers here at the VA, and so I had a chance for 4 hours to talk to people who were coming through and getting their vaccine, what questions they had. And definitely seemed like our Black veterans were more reluctant. And so when I was talking to them, the ones who came and got vaccinated, and asked whether they were working with their communities and families to try and encourage them to get vaccinated. And they said they were, and those were actually the longest conversations I had, because we were they didn't know either exactly, all of the reasons underlying why it was difficult to convince their children, their siblings, their parents to get vaccinated. So yeah, I think there's a lot of work to be done in the Black population in general.
Yeah, I'm curious, Dr. T, you showed some data at the front end of your talk about the neighborhoods and the zip codes and how vaccine is moving along. What is your feel of vaccine reluctance based on ethnicity and so forth in San Diego right now?
Yeah, I can actually pull up, if you don't mind going to the next question, I'll pull up in one of our backup slides for the press conference. I don't believe it was used. We have a slide specifically by race ethnicity for San Diego County over time in terms of vaccination. So I'll pull that up right now. Sorry.
I would just mention, in terms of my pulmonary clinic, I take care of a lot of patients with very advanced COPD, which is emphysema, or lung cancer, and quite the opposite of reluctance. There's been a lot of interest, and most of my patients got vaccinated as soon as they were eligible. And I think that's the right thing to do. And I think in a couple of weeks, we're going to talk about chronic lung disease and COVID at one of these dinners.
Yeah, I think from my personal perspective, a lot of it has to do with information and just making sure you're getting the right information and from trusted sources. My fellow panelists, you all are trusted messengers. We've done surveys. The county has commissioned surveys, and it has shown that folks like medical professionals, doctors, nurses, and then others in the community as well, to a lesser degree, are trusted messengers. So when you look at different groups and different populations. So this is a slide that we had in the deck for the press conference. I don't remember if it was shared. I don't think it was, but I could be wrong. And you could see over time, and Dr. Welch, and to the earlier points, you know, the African American population in terms of percentage vaccinated is the lowest, but I do want to caveat that there is a lot of folks who just don't mark their race, ethnicity, you know, so they won't mention it. So we don't know of those unknowns who that really is when we look at the data in aggregate. But you can see that, yeah, there's definitely a bigger amount of unvaccinated people in certain populations. And unfortunately, that does overlap to some degree of populations that are also more affected by COVID. And remember, it's not just case activity and case rates amongst these individuals, but if you are in a group that's disproportionately affected, you may also be more likely for other reasons, right, to have multiple conditions that put you more at risk of severe COVID and be more likely to be hospitalized or pass away from COVID. So to me, that's even more justification and reason why, you know, you should get the vaccine.
Great. Well, as anticipated, this discussion it flew by in what seemed like just a couple of minutes, but we're very close to the end of the hour. I would like to close by reminding everybody that about your slide about, you know, we're so close to the end. Nobody wants to be the last soldier shot in the war. And, you know, if we can just, you know, follow our guidelines or recommendations, and maybe we'll get rid of this thing soon, but it's probably a little bit too early to start congratulating ourselves and lightening up on all of our restrictions. Dr. T, thank you so much for spending the time with us. Thank you to our panel, Dr. Karati Alexander, Dr. Michael Welch, Dr. Philip Montgrain. This has been a wonderful session. I understand these sessions, including this one, will be available on YouTube. So if you missed any of this, please do go on to the Lung Association channel on YouTube. You can find this, and you can also find a link on the local Lung Association channel. Next week, we're looking forward to having Dr. Nichang Liang talk with us about stress and how to reduce stress during the COVID pandemic. Thank you very much. Be safe, everyone.
Everybody.
Bye. Stay safe.
Thank you. And that concludes today's Community Connections. Have a wonderful day, everybody.